In layman's terms, understandable terms, what is the thyroid and what is its function in the body?
The thyroid gland sits in the neck and it operates as the tone at which your body operates. So if your body makes too much thyroid hormone, you might feel overactive, you have a lot of energy, you can easily lose weight. If your thyroid gland is too slow, it may be underactive, you would feel just the opposite. You might feel tired and sluggish, you might be gaining some weight, you might feel cold all the time, and that's just the function of the thyroid, which is very different from the structure of the thyroid, which some people may have different nodules that you could find in the thyroid gland.
Thyroid cancer was what we're talking about, and hypothyroidism. Are they the same? And if they're not, how do they differ? Because we've heard of people who have hyperthyroidism.
Patients who have hyper or hypothyroidism do not have thyroid cancer in most instances. But if somebody has a thyroid nodule, we would want to evaluate that further to determine if that nodule has cancer cells or benign cells.
You talked about moodiness or inactivity or feeling sluggish, losing weight. What are the symptoms of thyroid cancer?
The only real symptom of thyroid cancer that a patient may have is the detection of a nodule or a lump in their throat. Either they might find it or their physician might find it on neck exam. But we also see a lot of patients who are completely asymptomatic, who have had a radiologic procedure for something not related to the thyroid in their neck, and we might find that nodule incidentally on that scan, say a CT or an MRI.
So you're saying radiation can put some people at greater risk for thyroid cancer?
Radiation can, but not from the CT scan or the MRI. It just might note that there's an abnormality there that might not have been detected by that patient.
If you are asymptomatic and there are no early screening tests for thyroid cancer, how is it diagnosed?
It's usually diagnosed by exam or by other scanning modalities that might incidentally find it.
Different types of thyroid cancer. I know the mayor has one type, but I saw that there were others. Tell us about the different types and whether they express themselves in different ways.
There's mainly 4 different types of thyroid cancer: papillary, follicular, medullary, and anaplastic. The most common type, which the mayor has, is papillary. The great thing about papillary is it's very easy to treat and the prognosis is excellent.
The other cancers, tell us about those forms of thyroid cancer.
Follicular is very similar to papillary, but patients have a slightly worse prognosis. Medullary is completely different from papillary or follicular, and the patients often present with nodal disease. And finally, anaplastic carcinoma is the most aggressive form of thyroid carcinoma.
Is it true that women are more often diagnosed with thyroid cancer than men?
Yes, about 2.5 times more women develop thyroid cancer than men.
Why does that?
We're not really sure why, but it may be that more women are seen by their physician than men.
And when you said that the diagnosis, because there's no early screening, it usually happens during an exam. Should this testing of the thyroid, making sure there's nothing in this area, happen at most regular physicals?
Yes, it should probably happen once a year during your physical exam.
So you said Mayor Williams has papillary thyroid carcinoma?
Correct.
So how is that treated?
There's many ways that we treat cancer, but initially everybody has surgery. Most patients have the entire thyroid gland taken out, but selective patients may have only the partial gland taken out.
What about the mayor?
The mayor had his entire gland taken out.
And again, was there a specific reason? You say some patients can have partial. What was the reason why you went with a total thyroid removal?
Well, for the mayor, we also noted that he had some nodes that had cancer cells in them. So if we notice that there is disease outside of the thyroid gland, then we would recommend a total thyroidectomy.
So you have the total thyroidectomy, then what is the protocol after that to prevent a recurrence?
We place everybody on thyroid hormone therapy. Not only do we do this because it replaces their thyroid hormone, which they need, but it also helps to prevent the recurrence of thyroid cancer. Also, many patients receive radioiodine therapy treatment, which is a very effective treatment for thyroid cancer.
What about chemotherapy? We usually hear that when we hear the word cancer and the way to prevent recurrence.
So thyroid cancer does not really respond well to chemotherapy, but we're very fortunate in that the thyroid gland is so unique that it takes up iodine to make thyroid hormone cells. So we can add radioactivity to that iodine and it will destroy all those thyroid cells.